Is support always bad? I mean, if we really need more stimulation, is support ever appropriate? Every now and then I hear, I love my traditional orthotics, whatever they are. They've really helped my back pain. So what's going on here? As the stimulation versus support guy, am I calling these people liars? Are they just wrong? Of course not. Like so many things in the body, there's a Goldilocks zone where too much is bad, too little is bad, but the sweet spot in the middle is just right. In today's episode of the Foot-Brain Connection, I want to explore when to increase stimulation, when more support is appropriate, and when a combination of both works best to create lasting clinical results. By the way, more often than the comment I just mentioned, I hear, I don't really feel like these orthotics are doing anything at all. Or even, I feel like these orthotics actually screw up my knee or my back or everything. When I say traditional orthotics don't work, in fact, they're part of the problem, I'm not saying they don't have an impact on the body. They do. They just don't actually fix anything. I never make people wrong for wearing their traditional orthotics. If their experience is that it helps their knee pain or their back pain, that's great. However, my question is, what happens when they stop wearing them? Typically, the problem just comes back. In fact, it never went away. It was just being covered up by an external support. This is one of my greatest frustrations with our medical system. So much of it is based on covering up symptoms and calling it fixed, without ever actually addressing the real cause. If you have to continue taking a medication for life, you're not fixing the problem. You're managing an ongoing, unresolved dysfunction. I see this happening with many of the top-selling medications that people take. Blood pressure, cholesterol, reflux. None of these treat the underlying cause of the condition. The same is true when we wear traditional orthotics, or even just wear modern supportive shoes. So, if that's the case, is support always bad? No. If you break your leg, you need a crutch, right? Or these days more commonly a boot. If you're an insulin-dependent diabetic, you need insulin. Traditional orthotics are a crutch. Sometimes a crutch is necessary. But does it actually do the healing? No, of course not. It just takes the pressure off the bone so the body can naturally heal itself. I understand that traditional orthotics can sometimes serve this purpose. But what happens if you never stop using the crutch? You don't see plaster casts so much these days, but when I was a kid they were common. They were really the only treatment for a broken bone. And if you're as old as me, I'm sure you remember what someone's arm or leg looked like when it came out of that cast. It was visibly shrunken and wasted. And that was after only 6 to 8 weeks. Imagine what would happen if they wore that thing for years. Yet I see patients who've been wearing their traditional orthotics for 30 plus years. Now, I know their feet aren't totally immobilized like they would be in a plaster cast, but the same principle still applies. No wonder their feet are totally weak and dysfunctional. And no wonder their gait, balance, posture, and movement patterns are disrupted. Their spine, joints, and muscles have all been adapting and compensating for years. The body is incredible at intelligently adapting to stresses. But when the stress never goes away, like, for example, when you wear shoes and walk on flat surfaces all day, it leads to an endless cycle of compensation that is ultimately degenerative and destructive. There are cases where the level of damage in the feet has progressed to a point where support may be necessary. I just hardly ever see them. I think the body has way more healing capacity than we give it credit for. A few years ago, I met one of the leaders of a barefoot shoe company. He told me that he used to work for a podiatry company, but that he'd switched over from the dark side. When I asked him what prompted this career change, he told me it was when he read research from within the industry that found only 2% of the population were candidates for traditional orthotics, yet they were being prescribed like hotcakes. Now, to be fair, I haven't personally read that research. I'm just relating what he told me. But it does seem to gel with a conversation I had with a podiatrist more recently. In his words, he said, I see many patients whose navicular isn't sitting on the floor, so I know orthotics aren't really what they need. But I have nothing else to offer them. So I give them orthotics. Personally, I think that's not a bad definition of someone who genuinely needs traditional orthotics. Someone whose navicular is sitting on the floor. To that, I would add, someone whose first MTP joint is so dropped and degenerated that it's causing pain and significantly impacting their ability to walk. Dr. Emily Spleakle is a functional podiatrist, human movement specialist, and author of the book Barefoot Strong. She's a proponent of barefoot training, natural foot mechanics, and the stimulation versus support paradigm. I've got huge respect for her work and I've learned a heap from her. Although she's not generally an advocate for traditional supportive orthotics, she also says that people with a completely dropped first metatarsal may need them. Even in those cases, I usually prescribe a hybrid approach, a combination of support and stimulation. It's okay to use a crutch, but you should also be doing the rehab work. That's where Better Balance Orthotics come in. Even when someone's feet are severely degenerated, you'd be surprised how much room for improvement there is. 24 years as a practicing chiropractor has taught me that this is true for almost everything in the body. I tell them to wear their traditional orthotics as needed, but to start with Better Balance for just a couple of hours a day, or even just on the weekends or just when they get home from work. It's like going to the gym. Even a few hours a week creates measurable benefits. That way they're starting to build some muscle activation in their feet, they're increasing their sensory stimulation to their brain, and they're re-educating their myofascial system, all whilst maintaining the level of support that their bodies come to rely on. Over time, most people are able to gradually increase their use of Better Balance Orthotics, often ultimately transitioning out of their old orthotics altogether. The key is to let them do it at their own pace, as their body strengthens and adapts. I see this approach being used in the medical management of injuries like sprains and fractures too. Advice has gone from total immobilization in a cast and bed rest to use of a less restrictive boot or brace and a graduated reintroduction of movement and weight bearing as soon as practically possible. The research supports this, showing it creates better long-term outcomes and faster healing. But for some reason, that thinking hasn't trickled down into the way we address feet with traditional orthotics and over-supportive shoes. This doesn't just apply to people with severely degenerated feet. I take a similar approach with anyone who's using or wearing traditional orthotics, especially if they've worn them for a long time. These people have been relying on a crutch for a while. For most of my patients, I just tell them there's no need to wear your orthotics in gradually, just chuck them in your shoes and away you go. Just don't wear them for the very first time if you're going to be on your feet for 10 hours that day. However, for patients currently wearing orthotics, I suggest they transition a little more gradually. Usually within 2 to 3 weeks, they no longer feel like they need their old orthotics. The same thing can apply to sports people. I generally suggest they don't wear them for the first time during the big game. Better to wear them in their regular daily shoes for a couple of weeks and then wear them in their sports shoes. It generally unlocks a whole new level of performance, but it happens more smoothly with a period of adaptation. So to answer the central question of this episode, is support ever appropriate? The answer is sometimes yes, but usually only in short-term, highly specific situations. And even then, the outcomes are usually better and faster if you include a stimulation approach along with that support. It brings to mind an analogy that I heard from Dr. James Chestnut years ago when I was attending his Move Well, Eat Well, Think Well training. He said, "The medical system is like the fire department. And if your house is on fire, you better call the fire department. They'll come to your house, they'll chop down your door with their axes, spray down your precious possessions, and if you're lucky, they might just save your house. But when it comes to rebuilding your house, you don't call the fire department." Although he was talking about chiropractic, I've come to understand that the same is true when talking about your feet and balance, posture, neurology, all that stuff. Traditional orthotics are the fire department. But when it comes to rebuilding your whole body function, you need Better Balance Orthotics. One last thought before I leave you this week. You might get a laugh out of this one. I had a patient last night. It was a rheumatoid arthritis case. He said to me, "I've had this pain in my toe for the last 2 years. I haven't mentioned it until now because there were so many other things that were more important going on. But now that everything else is doing better." So I cleared the toe problem using some of the new techniques I've developed recently and then moved on with the rest of the treatment. Right after I adjusted him, he said to me, "Andrew, I can't feel my toes." I wasn't sure if I heard him right. I said, "What?" He said, "I can't feel my toes." These aren't really the words that you want to hear after you just adjusted a patient. So I asked him, "What do you mean?" He replied, "I'm flexing my toes right now and I can't feel any pain. I've had that pain for 2 fucking years. What did you do? Talk about a moment of relief. Some of the stuff I've been developing to treat feet, and by extension the entire body, is actually pretty cool. It's changing really my entire practice. I taught the first part of it in Aspen a few weeks ago, and I'm teaching it again in Auckland at the next ICAK meeting. I taught a more complete version to my associates a couple of weeks ago, and it really shifted their understanding of how just small changes in the feet create major changes in the structure above, and helps everything else they do clinically to work better, faster, and actually hold once their patients walk out of the clinic. I feel like this is information that needs to be shared, so I'm thinking of running a one-day workshop for practitioners here in Sydney. It'll be clinically focused with a clear protocol that you can implement immediately to improve your patient outcomes. It'll also massively increase your confidence and certainty in prescribing better balanced orthotics to accelerate and lock in those outcomes. Now, obviously, there's a significant amount of time and investment required to make a workshop happen. So if this sounds interesting to you, please let me know. If the numbers make sense, I'll set the wheels in motion. For all my Aussie and New Zealand docs, I guarantee it'll be worth your time getting to Sydney for the event. I'm not kidding when I say this work is really changing my whole practice. Correcting the feet has become one of the first steps in my treatment protocol, almost regardless of a patient's presenting complaint. It literally multiplies the effect of everything you do after that. For my US-based docs, I understand it's a little far to travel for a single day. I've been invited to speak at 3 events later in the year in Boston, Washington, and Florida, so I'm thinking of planning a road trip through the Eastern USA and running small group trainings along the way. If you can gather a group of local docs, I'd love to talk to them in your clinic. Just let me know. I'd love to connect, share what I've learned, and help us all serve our patients better. I look forward to hearing from you. Cheers.